Okay, well, welcome, Megan. Can you introduce yourself? I'm so happy to have you here.
Oh, it's good to see your face. So yeah, I'm Megan Kranenburg. Like you, I am a doctor of physical therapy. And like you, I run a small little, I don't like to use the word boutique or niche, right? Because like niche is not 50% of the population.
Yeah, yeah.
So I run a small pelvic health clinic up just north of you, up here in Kitsap County, Washington. I actually run it out of my house, which is pretty cool. So you see behind me all my books and tchotchkes.
Mm-hmm.
Um, I am a nationally board certified clinical specialist in women's health physical therapy. So that's the big
Nice.
diploma. I can't, like, my undergraduate diploma is like this big. And the one
It
from
should be big.
the board of physical therapy specialties is bigger than my head. So board certified clinical specialist in women's health PT. And I like to think of myself as a full spectrum pelvic health physical therapist, treating men, pediatric trained, but the reality of the situation is that pretty much my entire caseload is women. And the vast majority of that are women in the first few years postpartum or the first few weeks or months postpartum. So I run kind of a hybrid outpatient practice where I do outpatient pelvic health. I'm a birth doula because I would really like my clinical question, and one that may steer me toward a PhD someday, is fourth, improved musculoskeletal care, improved physical therapy, early intervention for American women during that fourth trimester.
Mm-hmm.
So how can we make that change? And I think our conversation today is like a really exciting and big part of that. So I don't want to steal your thunder on what we're talking
Yay.
about.
No, I love that you're both a doula and a pelvic PT because it's such an amazing combo.
Fun. It's time and energy, and you have to know like your limits on the energy you have to commit to people for that. So I don't do it much, but when I do, it's really meaningful.
mhm. So as you and I both work with women, one of the
Mhm.
big diagnoses that we help women with is pelvic organ prolapse.
Yeah.
And for those that are listening, if you've not ever heard of that, it is where your organs can shift within your pelvis and they can start to migrate their way outside of the vaginal opening or just down the vaginal canal. It can
Yeah.
create discomfort. You can feel like a tampon's falling out. Some women have pain. It can really cramp our style, and it's actually super common.
Hmm.
So my stats that I've read, and I think you agree, it's just under 50% of all women are going to have a prolapse to some extent in their lifetime. Whether their lifestyle is affected or whether they really
Yeah.
feel it is really up in the air.
Yeah. That's one of the things that kind of blows my mind about prolapse is that the severity of your prolapse is not correlated to the symptoms that you feel. And um, I like to bring that up with clients too, so that we're so good at shame, aren't we, women? Like we're just really good at shame. Like,
Mhm.
well, it's not, my doctor said it wasn't that bad. Why is it so comfortable? Like you got to wipe your brain slate clean of that. You have to have this huge thing falling out of your body to care about it. Right. We
Yes,
can,
yes.
we can address this based on how you feel. And it doesn't have to be what a provider sees.
Mm-hmm. Yeah, many a time I've heard patients report to me that their provider, their doctor said, "Oh, it's not that bad. Just don't do anything. Keep doing CrossFit. When it gets bad, we'll do surgery."
Mm,
So,
mm,
so of course, Megan and I want to help women be empowered to know what they can do to prevent
yeah.
it from worsening,
Yeah.
reduce their symptoms, manage it the holistic way. And one of those ways that we do is through recommending that our patients get fitted with a pessary. And I have a awesome. She's got we're totally putting the video on the website. So a pessary. That's also another word that women look at me when I say the word and like I am speaking a different language.
Yeah.
We don't talk about prolapses in our culture.
No, not a lot at all. Not until we're over 65 anyway, right? Um,
Mm,
so I just took that class with Kathy Wallace like
nice.
a week and a half ago, and I know you came out and stayed with
Mm-hmm.
me to take that class last year.
Mm-hmm.
So we probably have pretty similar new information about that. I don't know if there was a lot of new research between when you took the class and I took the class, but at
Yeah.
least Australia is talking about it with younger women now. But I'm probably putting the cart ahead of the horse as far as like, let's keep talking about what it is.
Yeah, yeah.
Are.
Well, I think, one of the hard things to hear is I had a patient where she was a perfect candidate to get a pessary. So we talked about it over several visits, softened the idea. I tell people, think ankle brace meets tampon.
Yeah, like a menstrual cup.
Yeah. Yeah. Just think if you had an ankle sprain or it was unstable and you needed to go for a hike, by all means, slap on that ankle brace. Same thing if a woman that maybe she's had this prolapse since the birth of her last child, or maybe she is approaching menopause and having new symptoms whenever. And you can also be someone that never had kids, still have a prolapse. But if you wanted to be active and not feel that pressure or that pain, by all means, wear that ankle brace meets tampon.
Yeah, it is a conversation that needs to be bigger with younger women for sure. And I think there's such a growing voice in the physical therapy community for that. So, I think of us as the MacGyvers of healthcare, right? Like we can't do surgery, we can't prescribe drugs. So we have to look around us and go, what are the other tools at my disposal to get my patient back out there exercising, to get my patient lifting her kids into the car comfortably, to get her getting back, I already said exercise, or going to Costco and picking up. Those are the things that prolapse can really get in the way of. And if she wants more children, surgery is not an option right now. There's no medication on the planet that's going to fix this. We need to be optimizing her pressure system, and we need to be optimizing the support of her musculature and her connective tissues, right? So this, and there are so many other shapes and sizes of these on the market. This is my pessary. It's mine, right? So it's clean, it's washed. Don't worry about it.
Yes. So one of the damaging things I've heard recently is this patient went to a random doctor within the practice she went to. She didn't know the doctor, went in for the visit specifically to get fitted for a pessary. The doctor proceeded to tell her that he'd only ever fit grandmas for pessaries, and why was she there? So she found herself defending herself. Right.
I hear stories like yours. I mean, when you read like the different stories like that, or in our, the pelvic physio groups that we're both in, that kind of mentality just blows my mind. I haven't published the videos yet, but I did my little podcast with a local OBGYN friend of mine, and we talked all about prolapse and pessaries, and because she fit my pessary. And it's so refreshing to talk to like someone in that medical community who's on the same page with us to say, yeah, you want to be active. I need you active. That's for your mental health. Why wouldn't I try this with you? Why shouldn't we? And so the gender gap, we could talk all day about that. And we could talk about the fact that all the research about pessaries and comfortable fit and how it changes the nature of connective tissues is all in women over 65. All the research that we can pin our hat on, so that, that can be tricky for you and me as clinicians to say, I think this would be great for you to wear this, but I can't point to a journal article or like a systematic review of the literature to tell you that this will make a difference for you. But it just makes sense because we don't have that yet, right? We don't have that research.
Yeah, and it's true. I think because people aren't talking about pelvic organ prolapse, women don't even have the words to describe the feeling that they're feeling. So they don't even know to go to their doctor. They just know things feel different down there after a baby. And because they don't know how to advocate for themselves, or they don't have to feel that way, I think that's also stifling progress.
For sure. Yeah. I mean, gender bias in medicine about really life and death things is real. So how much more do we stuff under our hats the things that we, I am only going to give myself permission to talk about 3 things with my doctor, because any more than 3 things, and he or she might think that I'm a hypochondriac and I just need to go have a glass of wine and relax, right? Oh, if they're going to walk into the break room after I leave the door and like, got another one of those women again, right?
Yeah.
And this is, but if there's one thing to like talk about though, it's like, hey, this is just orthopedics. This is a failure of the connective tissues after a major event that did a number on the physiological nature of your muscles and connective tissues. Your entire musculoskeletal system has to adapt to pregnancy and having a baby. So this is just legit. And so while we don't have a lot of research for women in their 20s and 30s and 40s about how a pessary can improve the structure of your body and your quality of life, there is good research that in women over 65, it has been shown to help correct prolapse. And that's over 65. In a younger body,
and they don't have as good of connective tissue resilience.
They don't have the same hormones going on. When we're younger, how much more of an optimal time is that to splint that uterus up and to go in and occupy some space. So I talk with my hands a lot, but like in my head here, I've got like a rectum and a bladder, and I'm going like, the pessary can come on up and get that bladder back where it belongs and get that rectum back where it belongs, or at least give a little support internally. And then in a younger body, that connective tissue has a better chance and more time to remodel and reestablish optimal positioning, right?
Yes.
So it's just something that it only makes clinical sense. So I guess I would tell people, if you're talking to a provider that doesn't want to talk about basic clinical sense, you can vote with your pocketbook and find a new provider too, you know?
Yes. Yeah. I think it's also important to try to find a provider. I don't know if you have a favorite person you like to send your clients to. I definitely do. This doctor is more out on her own. She's not a part of a large system. So she is able to spend the time with the patients, and my patients definitely see that.
Yeah.
They feel, because to get fit for a pessary is not a 10-minute appointment.
It can't. Mine was like 5, and so my friend the OB just laughs at me because she's like, "Don't tell that story anymore," because she right sized right away, got up. But
like,
yeah, it can be, and I've seen that with some of my clients who are willing to put in the time to go in and, okay, let's just start you with a ring pessary. This is the most popular time, but do we need to try a slightly different size? Do we need one with like a dish shape to it? There's a difference between this type of pessary, which is a supportive pessary meant to keep organs up above it, and pessaries like a donut or the cube shape that are meant to occupy space, right? So it really depends on the severity of prolapse that we're looking at, and it also depends on how well the muscles internally are functioning too. That was kind of a light bulb moment for me at the class recently, because I've become such a fan of pessaries, both personally and then professionally, that I'm just like, hey, if there's a hint of prolapse, just get a pessary up in there. But there are certain conditions related to muscle damage where pessaries can, they're not going to be as effective as they would be for other people. But at the end of the day, it's a thing that if you try it and you don't like it and it doesn't work for you, you can chuck it in the waste bin and throw it away. And you didn't have surgery. You haven't been on any medication. There's like no negative. There are some side effects of pessaries if you don't take care of yourself and don't take them out regularly to clean and give your body a rest. But other than that, there's really no permanent negative side effects to it. So why not try it?
Definitely. So the big thing also is, if, especially younger women, you want to go back to running, but you're feeling that heaviness, incontinence, and you don't want to wait until your muscles are amazing and perfect.
I'm still waiting. And my youngest is 8 years old. So because with prolapse, as someone who lives with prolapse, I reckon with the emotional fallout of prolapse too. I've lived that arc myself, and it's something that I spiral back through every now and then. And I see that with my clients. Part of prolapse is realizing that that it's a management.
Mm-hmm.
There's not really a cure for prolapse. It becomes a management and optimizing and taking really good care of the system that you have to keep it from getting worse down the road, right?
Yes.
So the woman who wants to get out and run, it may not matter if she tries at 3 months postpartum or waits 3 years postpartum. It might still be something that she needs to have that pessary and to have that PT for, so that she knows how to do that without exacerbating the situation, right?
Yeah.
And why not at 3 months instead of 3 years? Because that's a whole lot of time lost for someone who uses running as their mental health, so she goes running with her girlfriends at 5 a.m. 3 times a week, and now she can't have that. Like, how isolating is that, you know?
And then if you can't run for 3 years, how deconditioned your body is, it's really, really painful. Actually, I'm going through that right now.
Yeah, I know.
I have a 3-year-old and I'm starting to train again, and yes.
That's why I got this, right? I wish like I said, my youngest is 8 years old, and I had to figure out that this would be a good idea for me on my own. And luckily and I knew the OB in town to go talk to and be like, why am I not wearing a pessary? And she's like, I don't know, let's get you one, you know? And that's huge. But it was half marathon training that really undid it for me, with my prolapse being mildly symptomatic to very symptomatic and depressing.
Yes. And I think the last thing I wanted to touch on is the future of women's health, in my opinion, has to include more partnering with the surgeon and the PT.
That'd be nice, wouldn't it?
Yeah. Because, I mean, we didn't talk about the failure rate of surgery.
Yeah.
But we know that it's pretty high.
It can be high. I read a recent article about that, and I don't know if it was we can link to it on your website or link to it on your page when you post this, because I saved it. It's on my hard drive. It was a fairly recent study that looked at failure. I think that we have to look at surgical failure in 2 ways. There's the structural failure, which are those little minute measurements, right? So you and I know that we measure prolapse with the POP-Q, the pelvic organ prolapse quantification instrument, where we're getting out the little measuring stick and being like, okay, how far do things come down and how wide do things open? And it's a big thing with a lot of gee whiz numbers, right? So they use the POP-Q to say, okay, this is how severe the prolapse was before the surgery. Then hello.
That's so weird. That was fun.
Right? It's okay. That's real life, right? So just to be a numbers nerd, but so they measure the success of the prolapse surgeries by saying, okay, the POP-Q test showed all these numbers and it was this bad, and then we did the surgery, we tacked everything up, and now the POP-Q is so much better. And then sometimes I think it's still good for us PTs to not get too bent around the axle about the failure rate of the surgeries, because they're measuring failure as a degree of drop from where the surgery left everything. And so they can show that, yes, well, about 68-70% of the surgeries have a technical structural failure, and that things have descended again, maybe not back to where they were before the surgery, but they have failed past a certain point after the surgery. So that's what they mean by structural failure. But they did find in that research that people still had they felt a good quality of life, that they still felt symptomatic improvement. So I think, like we said, like partnership, for me, when I read that was a humbling moment to be like, okay, my partnership needs to go back the other direction too. And not just say like, oh, their failure rate and everyone's miserable 3 years after they have the surgery, right? And us PTs are the saviors.
Well, and the hard part,
everybody.
Bias would tell also that we see the people that come back after.
Yeah. And also, I think for very valid reasons, surgery is just not an option for everybody based on your medical history. Maybe your cardiovascular risk puts you out of it, or you have a bleeding disorder and you can't do that, or just there are ethical and cultural considerations to take into, and religious considerations. Or just, I just don't want to have a surgery. I've had clients after menopause, I've had clients postpartum, that the pessary really can be the thing that they go, I was on the fence about it, but I'm glad you told me to give it a try, because I walked out of that room crying because I hadn't felt that good in like 3 years, that they finally get that up. But it is kind of an ongoing trial and error troubleshooting process.
Yes, I would say there's no one size.
And there's but hey, the body is never that easy.
No, it isn't.
That'd be nice.
But it's the main goal for our chat is so that we get the word out about pessaries. And we also talk about, how common prolapse is. And these things they're not scary, but the shame and the fear come from the not knowing about it. But when it does happen to someone's body, they're devastated. I don't want to underestimate that. It is pretty mentally challenging to do.
It is. And I just like to remind my clients, as I had to learn myself too, is nobody else can feel your body from the inside out. So it's really not my job to tell you that this is something to address. And it's not even your OBGYN or your midwife's job to tell you how bad something is. You're the one living that reality. And if every time you step out to try to go for a run again, you end up feeling like your rectum's going to fall out of your body later that day, or you have voiding problems, or you feel like you're sitting on a softball, then you're the one who knows that reality. And the rest of us can't make that decision for you. So I would just continue to encourage women, like, keep advocating for yourself, because this is a topic that gets blown off a lot.
Yeah.
And it's pretty easy. I won't say easy is the wrong word, but there are tools in the toolkit that you and I have, and that good OBs have, and good listeners have, that we can optimize how those pelvic organs are supported within the system.
Yeah. We'll have to talk a future one about what we do. It's beyond the pessary, because we don't even give people pessaries.
I know, right? I do. So they fold up like a little taco, and you just, put it in your body like a menstrual cup, and then it opens. That's why you can't put too much lubricant. This adorable client that I worked with over the last few years after both of her kids, and she got her pessary. She went to the OB. They talked about how to put it in, and she's like, well, I went home and I put the lubricant on it, and I couldn't get it in because it kept flying out of my hand. I'm like, okay, just a little bit of lubricant, just right there. Like, we don't coat it.
That is awesome.
But that's the school of hard knocks, right?
It totally is. Well, thank you so much. That was perfect. So if anyone listening has questions, you can definitely connect with me on the website. I'm going to put Megan's contact info too, if you find yourself up towards the Kitsap Peninsula near Seattle. She would love to be of help there too. So thank you.
I'm a pessary evangelist. Happy to spread the good word.
Awesome.